Welcome to the Healthcare Advocates Summit, created for advocates by advocates. Join us for a look back in celebration of all that we've accomplished.
So the first Healthcare Advocate Summit took a hot minute to execute. You know, we had to postpone it a couple of times and we didn't know if we would ever get there, but we made it. We made it to that first year, and being able to walk into that property with all the exhibitors and the support that was there was kind of surreal, and seeing our brand and all of these other things. But that first year, just getting to that was such an accomplishment, and every year since then.
So we had about 200 people our first year, and we knew a lot of them. So when we moved and the audience grew and there were people we didn't know there, it was fun for me. And then it just grew even further by year 3. Lots of people we didn't know, but all coming with the same message. We've heard this is great. We want to see it start from the people we know to all these new friends that we got. We did a second line parade down Bourbon Street. So through the French Quarter, down Bourbon. And I really had to stop Melissa and just look around, because at that moment I was like, we're here with all of these people walking through a city. People are cheering us on, not even knowing what we're doing. It was just so incredible. So when I look back at the pictures and the footage from that, I can kind of see those pinch me moments. And it's one of my favorite memories that we've had.
I've seen the conference grow over the years, and the first one that I attended was kind of what is this? What's this all about? And then as I learned more about the organization and met some of the wonderful people that are part of it and their passion, this is something we want to be part of. So as myself, coming from a manufacturing company, really trying to learn about the aspects of the challenges that are faced by patients, what are some of the connections that can be made across different stakeholders, that really got my blood flowing. And then seeing it grow over the years was wonderful.
I think one of the things that we have found is that the healthcare industry can be very siloed, and when you have people working in silos, the ones that suffer the most are patients. And so it's important for us to be able to get out there, get involved, find out what the pain points are for patients, and find out what people are bringing to the table from a solution standpoint, and then work out ways that we can partner together.
There isn't really another conference like this where we have so many different areas of the business. So, you know, I work for a specialty pharmacy, but then we have all of our foundations, our nonprofits, all of the different people that are involved to help. So it's a great way to connect and collaborate and have those really organic conversations to see what we can do to all come together and make a difference.
I have been at the Healthcare Advocate Summit every year. I was at the very first year in Galveston, Texas, and it has been instrumental from a business-wise, personal-wise. It rejuvenates me from a business standpoint, being here and seeing other people that get it, that understand that there's things that we can do to improve the healthcare system. The connections I've made here are invaluable. There are people that I deal with, colleagues now that I talk with on a monthly basis, that I have met at the Advocate Summit.
I think being in the healthcare space, especially as an advocate and a chronic illness patient myself, that we get burnt out really easily, and events like this kind of really pump you back up and really show you what it means to be an advocate around like-minded people who are really working hard to make a difference in this space. We have a great opportunity to learn from each other and really get different perspectives from across the whole system.
We could not have pulled this off without all of our participants. Everybody who has supported this event, who has talked about it, who has shared it, everybody who has helped us just really shape this. All of that feedback, being able to really have them as a part of the planning process is, I think, what more conferences should be doing as well. And that's what we're doing, because it's not our event, it's everyone's event. It's everyone's event who took 100+ hours away from your family, your time, your jobs, and you're here to spend it with us, and that's a huge weight to make sure that we make sure you leave here with something.
Every person here has a reason to be here, but we couldn't possibly do it without the support of our sponsors. And really, the sponsors and exhibitors that attend, they're just as much participants as those of us that work in healthcare. Because without them, we can't do our jobs in medication access. They're our lifelines, and oftentimes our first phone call in any problem that we have. So to have them here, to have them participate, to have them to be able to connect one-on-one with us truly makes our jobs easier. So thanks to the support of our sponsors and everyone who attends, this is absolutely a conference for everybody.
The Healthcare Advocate Summit is indeed a conference for everybody. No matter your background, we are thrilled to have you here as we work together to improve access to care.